Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us try to answer some quizzes in gynecology. Please choose the one best response. Let us start with the first one. Which of the following statements concerning hysterosalpingography is true? Again, which of the following statements concerning hysterosalpingography is true? A. Lipiodol is a water-soluble iodinated contrast agent. B. Subserous fibroid may be diagnosed with this procedure. C. Abnormalities of the uterine cavity may be diagnosed with this procedure. D. Less than 3 ml of contrast medium should be used to avoid spill from the tubes into the peritoneal cavity. E. The test is done in the premenstrual phase. Please choose the one best response and try to answer before me. Okay. The first one, A, is false. Lipiodol is non-water soluble, not water soluble. Subserous fibroid, of course, cannot be diagnosed with hysterosalpingography. It is out of the cavity. It is on the surface of the uterus. C. Abnormalities of the uterine cavity may be diagnosed with this procedure. Yes. It looks like filling defect in the uterus in case of submucous fibroid, for example, or endometrial carcinoma, or endometrial polyp, or Usher-Mann syndrome. So any abnormality in the uterine cavity can be diagnosed, yeah, and presented as a filling defect. So C is right, it's true. Less than 3 milli, of course, of the dye is wrong. The test is done in the premenstrual phase, of course wrong, because it is done post-menstrual. So the best one response here is C. Abnormalities of the uterine cavity may be diagnosed with this procedure. Let us go to the next. Which of the following characteristics of developed countries may correlate with higher incidence of endometrial cancer? Again, which of the following characteristics of developed countries may correlate with their higher incidence of endometrial cancer? A. Use of oral contraceptives. B. Higher level of air pollution. C. Higher fat diets. D. Lack of condom use. E. Decreased life expectancy. Please choose the best one response. Try to answer before me. Yeah, the best one response here is C. High fat diet. And excess fat diet leads to excess in female estrogen hormone, which is a risk factor for endometrial cancer. So let us go to the next. Which of the following is the most accurate description of stage 2 endometrial cancer? Again, which of the following is the most accurate description of stage 2 endometrial cancer? A. Involvement of the uterus and the cervix, but no extension outside the uterus. B. Invasion of half or more of the myometrium. C. Cancer confined to the uterine corpus. D. Local or regional spread of the tumor. E. Spread to pelvic lymph nodes. Please choose the one best response and try to answer before me. Okay, the one best response here is involvement of the uterus and the extension, but no extension outside the uterus. So A is the right answer, or the best one response. A, involvement with the uterus and the cervix, but no extension outside the uterus. This is stage 2 endometrial cancer. Go to the next, please. Which of the following is early symptom associated with endometrial cancer? Which of the following is early symptom associated with endometrial cancer? A. Unexplained weight loss. B. Pain in the pelvis area. C. Abnormal vaginal bleeding. D. Lower limb edema. E. Pruritus vulvae. Please choose the one best response. The one best response here is, of course, abnormal vaginal bleeding. And this is the cause of why endometrial cancer diagnosed usually early, because it presents itself with the bleeding, abnormal vaginal bleeding. So the best one response here is C, abnormal vaginal bleeding. Let us go to the next. Which treatment option is best with a stage 1A grade 1 endometrial cancer? Again, which treatment option is best with stage 1A grade 1 endometrial cancer? A. Surgery. B. Hormone therapy. C. Surgery and chemotherapy. D. Surgery and hormone therapy. E. Localized radiation. Please choose the one best response. The one best response here is A. Surgery. Why surgery? Surgery without chemotherapy or hormonal therapy, because it is an early stage with grade 1 differentiation, stage 1A grade 1 differentiation. So the prognosis is good with surgery alone. Total abdominal hysterectomy and bilateral salpingography is quite enough. Let us go to the next. Approximately 80% of all cervical cancer are classified as which of the following types of cancer? Again, approximately 80% of all cervical cancer are classified as which of the following types of cancer? A. Adenocarcinoma. B. Neuroendocrine tumor. C. Sarcoma. D. Squamous cell carcinoma. E. Adenoacanthoma. Please choose the one best response. Of course, the one best response here is D. Squamous cell carcinoma. Yeah, this is the commonest. Let us go to the next. If symptoms do occur in the earlier stages of cervical cancer, which of the following is the most common finding? If symptoms do occur in the earlier stages of cervical cancer, which of the following is the most common finding? A. Back pain. B. Foul-smelling vaginal discharge. C. Pelvic pain. D. Postcoital vaginal bleeding. E. Dysuria. Choose the one best response. Try to answer before me, please. Yeah, the best one response here is D. Postcoital vaginal bleeding or contact bleeding. Postcoital vaginal bleeding. Yeah. Let us go to the next, please. A 47-year-old woman presented with contact bleeding for the past 4 months. Result of current PEP test show severe dysplasia, and the colposcopy confirmed the presence of severe dysplasia. Which of the following is the most appropriate next step? Again, 47-year-old woman presented with contact bleeding for the past 4 months. Result of current PEP test shows severe dysplasia, and the colposcopy confirmed the presence of severe dysplasia. Which of the following is the most appropriate next step? A. Loop electrical excision procedure. B. Pelvic radiation therapy. C. Radical trochelectomy. D. Simple hysterectomy. E. Follow-up with PEP test after 6 months. Please choose the one best response and try to answer before me as usual. Yeah, the best one response here is A. Loop electrical excision procedure is a good choice for treatment of such case with severe dysplasia. Okay, Let's go to the next. Which of the following is considered a cause of false amenorrhea? Again, which of the following is considered a cause of false amenorrhea? A. Imperfect hymen. B. Uterus didalvis. C. Testicular feminization. D. Turner syndrome. E. Sheehan syndrome. Please choose the one best response. The one best response here is A. Imperfect hymen. Yeah, that's right. Go to the next. Which of the following statements concerning endometriosis is true? Which of the following statements concerning endometriosis is true? A. Malignant changes are common. B. Diagnosis is established by history and physical examination. C. It is more common in postmenopausal women. D. Affected women may present with infertility. E. The most common site of involvement is the omentum. Please choose the one best response. The one best response here is D. Affected women may present with infertility. Yeah, that's right. This is the end of this quiz. I hope it was beneficial for you. This is my book published on Amazon. Textbook of Obstetrics, textbook Gynecology, contraception handbook, multiple choice question book where you can find many other questions, medical disorder in pregnancy, and the gynecologic oncology. This is my box. You can reach my site on Amazon here. This is the link. I'll put it in one comment. Other lecture and the quizzes you can find also on YouTube channel in this link. I'll put it on another comment. My third site is my blogspot.com here. Thank you everybody. My best wishes for all of you.